What was the discussion like with your gynecologist? Were they saying you couldn't have a UFE, or were they promoting myomectomy surgery, or how did that discussion go?
They had a lot of questions, they did, but more than anything, they were just amazed. Like I say, some were against it, some were for it.
Oh,
But
okay.
at this point, I couldn't listen to the against part because we was here.
Right.
And I already made it to, going into my second trimester. I knew whatever you did, it worked.
Well, and given your history, you had had a number of pregnancies
Right.
in the past, 4, if I'm
Right.
not mistaken, and none of them ended up with a child, so that
No.
you'd had this recurrent, you had the ability to get pregnant, but because of the fibroids, you weren't able to keep the pregnancies.
Right.
And so one of the many important differences is that with living fibroids, which can cause difficulty either getting pregnant or keeping a pregnancy, after an embolization, those fibroids should be completely knocked out and neutralized. They can't grow. In fact, every day they're getting smaller and smaller and getting out of people's way, if you will. And so while we don't say that every patient that wants to have a child should have a UFE, there are certain patients clearly where it makes sense, and you were, given your history, it made perfect sense.
It made perfect sense, yes.
You had multiple fibroids. They surgically can't get all of the fibroids out. Even if you were to have undergone, myomectomy surgery, you would have been left with living fibroids after they're done surgically. And so that's another reason to consider UFE rather than a myomectomy, because not only is myomectomy surgical with a much higher risk and long recovery, it doesn't address all of the fibroids, only some of them.
That's true.
And so the ones that are left behind would grow during a pregnancy and could be a problem, versus UFE, which is not only not surgical, it typically knocks every fibroid out and gives you, I think, the best chance for someone that has numerous fibroids. It gives them the best chance of having a child.
And I must admit, it does, because I worked through my whole pregnancy.
Wow.
And, at first I was nervous at first, but I can tell that it just felt different. Everything felt different. I knew the baby was able to grow. I wasn't in so much pain. It was different compared to when I had the fibroids. Even when it was in the beginning, I still had a lot of pressure, a lot of pain, and I actually blew up. And you would thought I was more pregnant than farther along than I was. But I wasn't. But It was because the fibroids, they were growing with the blood supply, and it was just expanding and getting bigger and bigger and bigger. So even at the procedure, when I was pregnant, it was different. I literally worked to the end.
Wow.
Where I went to get induced on Wednesday. I stopped working that Monday, and I went to go.
Wow.
I went to go have the baby Wednesday. So it was a big difference. It was a big difference of how I felt overall after the procedure.
And 9 pounds, 6 ounces?
Yeah.
So it wasn't a small baby, or sometimes they're concerned about growth retardation or some other issues that are mentioned. Again, kind of misconceptions about pregnancy after a UFE.
Yeah.
Our experience has been full-term vaginal births. So again, unlike surgery, myomectomy, which requires the patient, if they get pregnant, to have a C-section, our patients are typically full-term and vaginal, as you found, you saw that you had that opportunity to go vaginally, and then some women will elect C-sections. It's always an option, but it's not a mandate. You didn't have to have a C-section. You have an option.
Right. It was an option. It was an option due to the weight of her, and it was just a lot of pressure on me. But other than that, just overall, and even after recovering from me having a C-section, it still feel a big difference. It's not the pressure, it's not the weight, and I still feel lightweight. And within day 2, my stomach was flat. It was a big difference, no pressure. It wasn't going to the restroom a lot. All that stopped. So I felt like I got my life back, And it was just, I was in a more happy place than what I was. Clothes felt different around the waistline. It was just a big difference.
So all of those things happened right after your UFE. You could tell as soon as you had the UFE procedure, you felt better. So a lot of it sounded like the bulk related symptoms, the abdominal pelvic pressure, the pelvic pain, urinary frequency, all of those things
completely it completely stopped.
Wow.
It completely stopped. So like I said, I got it done March 12th. And within that week of just even when I woke up from, after feeling the medicine wearing off, you still felt a difference. It was a big difference. So that right there alone gave me confirmation that I made the right decision to do what I did.
Well, you got a beautiful result. There's no
Yes.
question about that. She's precious.
Thank you.
But as you saw, the bulk related, that's what we see commonly, that of the bulk related symptoms like pelvic pain and pressure, urinary frequency, versus the bleeding. The bleeding takes a little bit longer to see the dramatic difference. The first period a woman has after a UFE can be lighter, but the first one's really a wild card. Usually by the second period, they notice, yeah, this is definitely better. And by the third period, even better still. That's why I like to wait to see everybody at that 3-month visit and see, can they tell that their bleeding and bulk-related symptoms are significantly better? They should. And we also look at the MRI to make sure that the fibroids are all completely dead.
Well, yeah, I must say I did see a difference with the cycle. I seen a big difference. But like I say, I just wasn't expecting the pregnancy because I was doing the mommy makeover. So it was just, yeah, it was something totally different. But I felt different altogether alone. Even the cycle was different. Just everything, my hormones, how I felt, everything was completely different compared to me in the past of how I felt. So I know for a fact, even with exercising, it went down a lot.
Okay.
So everything was a big difference. It was a really big difference. Yeah, so I know for a fact that was the best decision I could have made, coming to you, having it done. I really want to thank you. I feel like you did an awesome job. I must say, I never felt better than I ever felt in a while. So I really want to thank you a lot for
That's my pleasure. It's what keeps me coming to work every day.
Yeah.
To see miracles like this.